The degenerative and debilitating condition known as neuropathy affects millions of Americans. Fortunately, in Hershey, there's a wellness center that prides itself on staying ahead of the curve using cutting-edge technologies to help patients. Madeira Chiropractic Wellness Center is sponsoring this segment to share more about neuropathy, and Dr. John Madeira joins us now. Talk about neuropathy. What is it? How does it affect your body?
Well, Amy, neuropathy is a really serious condition. 20 million Americans have it, and it literally means disease of the nerves. So what happens is the nerves begin to die, particularly in the legs and feet, and eventually in the arms and hands. And it gets really serious because it affects your ability to walk, to feel your feet, to drive a car. Eventually, you can end up in a wheelchair, even losing your legs to amputation.
Oh my. So what causes this, and then what are some of the symptoms?
Well, there's 130 different known causes.
Oh gosh.
So the three most common we see in our clinic are diabetes. Over 60% of diabetics will develop neuropathy. Chronic back conditions because the connections between the nerves as they go down the legs and to the feet and to the arms and hands, of course. And then chemotherapy is the next most common one that we see. Things like Agent Orange can cause it, alcoholism as well.
Can it be reversed?
You know, what's exciting about it is it can be reversed.
Oh.
You know, even the Cleveland Clinic now says that neuropathy can be reversed, it can be prevented. So there's new exciting ways, and we're part of a network of 500 doctors nationwide that are doing a new program that actually helps to reverse it and improve it, not just treat it.
That's so interesting. Talk about the treatment though. What can you do?
Well, the treatments up to this point have been pretty much prescription medication, and the problem is that you can't out-medicate neuropathy. You just have to keep giving more and more doses, and the idea now is to just kind of keep the patient comfortable. And that's not all bad, but up to this point, there's not been a lot done that helps to improve it. So what we do now, we know that with low-level light therapy, with electrical nerve stimulation and nerve re-education can help to heal the nerves, and specialized nutrition that's designed just to help neuropathy patients to improve circulation and grow new blood vessels and things of that nature.
Can that actually go towards the reversing it, or is this just for treatment?
Yeah, over 90% it's over 90% effective, 92% effective with most patients. And that doesn't mean necessarily that it cures it, but it certainly improves it. And if we get it early enough, it can be turned around significantly.
Is it something that takes a while to actually realize that maybe you're battling? Like, does it start small or does it start?
It typically starts in your feet with numbness in your feet. That's the classic sign. And it can take 20 years to fully develop. Some people, though, it can happen in 15 months.